Hi, my name is Agatha. I'm a baby doctor. Yeah. So today I'm just going to talk about the seizure, or what we popularly call convulsion. So yeah, if a child is having convulsion, what you need to do as a parent or as an adult watching this child having a convulsion. So convulsion is usually very common in children between the ages of 6 months and 6 years. It can happen in older people, even in younger children. But I'm just here to talk about the febrile convulsion, which is quite common. So one of the things that happens is when you see your child having a seizure or a convulsion, the natural thing to do is to panic, because it's very distressing watching your child go through that. But I want you to know that the seizure itself, or the convulsion itself, is not dangerous as it looks, right? So the first thing to do is to make sure that this child is in a safe position, which we call a recovery position, or in medical terms left lateral position. So what you need to do first, if the child was lying on their back or on their front, whichever position they were, try to roll the child a little bit towards the left hand side of their body, and then you place them on the left hand side of their body. Then lift the bend the head a little bit backward, just a little bit backward, and then lift the chin a little bit. That way, whatever content is in the mouth, maybe vomiting, maybe saliva, whatever it is able to come out nicely and not get into the child's airway, because that's what may then be dangerous if it gets into the airway. So that's one thing. Secondly, if you're able to time it, like if you have a phone on you, you can actually press the time. I'll tell you why. Because when you get to the hospital, right, eventually when you take this child to the hospital, the doctors will want to find out how long did this seizure last, because that will help them in knowing what to do for this child and what kind of seizure this is. So if you have a timer, you can time your phone, or if there's a clock around, you can just look and note the time that this seizure started. Then the other thing to do is not to put anything into the child's mouth, because this is what is very common. People do it mistakenly and unknowingly. People tend to try to put things into the child's mouth, maybe fingers, spoons. Do not put anything into the child's mouth. Not spoon, not your finger, not anything. Don't put anything into the child's mouth, because the danger in it is, in that process, you can pull off the child's teeth, and that can then go into the airway and cause obstruction, which is more dangerous, which can even kill the child. But the seizure in itself will not kill the child. So I don't know if you're understanding what I'm trying to say. So yeah, those are like 3 quick things to do. Place the child in a good position or recovery position. Secondly, try to time the duration of the seizure. Thirdly, do not put anything into the child's mouth. And then the fourth thing you need to do is just try to call for help. Maybe if you need to rush the child to the hospital immediately, you can then rush the child to the hospital. Or most times the seizure would have stopped before it is 5 minutes time, which the child then goes into this post seizure state, maybe a little bit sleepy, a little bit drowsy, and things like that. That is not the time for you to try to feed your child or anything. Just allow them recover from that phase. What you need to do as a parent or as an adult is then for you to take this child to the hospital. Yeah, another thing I wanted to add, that time the child is having the seizure, do not try to give any medication, because the child is not conscious at that time, and there's a likelihood that they may choke on whatever you try to put into their mouth. So do not try to give any medication. Do not sprinkle water on the child. That's another thing people do. They try to sprinkle water on the child and all of that. You don't need to do that. Do not put anointing oil or olive oil. Do not apply it on the child at that time. Most likely, this seizure is due to fever in this child. The fever could have been from anything, maybe cough, cold, anything at all could have given this child a fever, and then the child goes on to have a convulsion. If you apply anointing oil or olive oil on the child at this time, what you're simply doing is you're retaining the heat into this child. So the child is already having fever, and then you put anointing oil or olive oil all over the child. So the child then goes on to retain more heat, which is not helpful for the child. So yes, do not pour water on the child. Do not soak the child inside water. Do not apply olive oil or anointing oil on this child. Just put the child in the recovery position and then take this child to the hospital. I'm not so sure if this was very helpful, but if this was, just respond in the comment section or by liking this video, so that I'll know you got value for this, and then I'll be encouraged. Thank you.